My blood sugar is very high after I started to take steroids. What should I do? In this video, we'll talk about what medications are steroids, whether you need to change your medication after taking steroids, and if so, how to change it. This video is only for people who are not taking insulin for their diabetes. If you have type 1 diabetes, or if you take insulin, please see my other videos to learn how to change insulin dose based on your blood sugar. Some examples of the most commonly used steroids are prednisone, methylprednisolone, also known as Medrol, dexamethasone, also known as Decadron, and hydrocortisone, also known as Cortef. Any steroid pill or injection can raise blood sugar. Inhaled steroids, which is a type of steroids that you breathe into your airway, and topical steroids, which you rub into your skin, can also raise blood sugar, but to a much less extent. Generally speaking, the more steroid you take and the longer you are on steroids, the higher your blood sugar will be, and the more likely you will continue to have high blood sugar after stopping the steroids. For example, if you only take prednisone 5 mg every day for 5 days, your blood sugar will go up, but will not go up a lot, and most likely your blood sugar will go back to baseline after stopping prednisone. However, if you have to take 60 mg of prednisone every day for 3 months, your blood sugar will be much higher while you are on the medication and is likely to stay high even after stopping prednisone, because it has changed your body's metabolism after a while. In this video, we will limit our discussion to situations where you only need to take steroids for less than 10 days. If you have to take steroids for a longer period of time, especially for more than a month, you should consider a change in your diabetes medication for long term. In addition, we will only limit our discussion to people who do not take insulin. If you have type 1 diabetes, please refer to my other videos. Then the next question is, I'm taking steroids, or I have just taken steroids, and my blood sugar is high. Do I need to change my diabetes medication now? It depends on how high it is. If it is less than 400, you do not have to change your medication. The reason is blood sugar of less than 400 for less than 10 days is unlikely to cause any serious consequence. You can simply eat less carbohydrates and do exercise to reduce blood sugar. However, if your blood sugar rises above 400, you should start to check your blood sugar at least every 6 hours and take short-acting insulin like Novolog or Humalog to correct high blood sugar according to a sliding scale. If you're not familiar with the concepts of short-acting insulin or sliding scale, you can go to hmf-diabetes.com and search these words. The sliding scale is calculated by dividing 5,000 by your weight in pounds. It sounds complicated. Let's now use some examples to better understand this. The first example is a lady with type 2 diabetes. Her only medication for diabetes is metformin. She has just started to take prednisone for a flare-up of her COPD. COPD is a condition of the lungs that gives people breathing problem. Her blood sugar jumped to the 200s after starting to take prednisone. She is expected to take prednisone for only 5 days. She has type 2 diabetes, and her blood sugar is high, but not very high, not over 400. So the high blood sugar is not going to put her in immediate danger. In addition, she will only take prednisone for 5 days, so a little higher blood sugar over such a short period of time will not be a big problem for her health. I suggested that she can eat less carbohydrates and do more exercise on those 5 days. Her blood sugar came down a little bit to around 180 to 240 range. After she stopped prednisone, her blood sugar went back to her baseline. Now let's look at a second example. This is a gentleman who has type 2 diabetes, and his only medication for diabetes is glipizide. His weight is 200 pounds. He just got 1 shot of steroid in his knee for knee pain. His knee pain was better, but blood sugar jumped over 400 the first day after the steroid shots. He did not expect to have another shot of steroid in the near future. His blood sugar is so high that it can trigger serious consequences like diabetes ketoacidosis. So he needs to start checking blood sugar more often and take short-acting insulin to correct high blood sugar according to a sliding scale. I suggested that he starts to check blood sugar every 6 hours and take insulin Novolog for high blood sugar according to a scale of 1 unit for every 25 points of blood sugar above 150. How did I get the number of 25? His weight is 200 pounds, and if you divide 5,000 by his weight in pounds, 200 pounds, you will get 25. This is likely a conservative estimation. He will likely need more insulin than this, but I did not want him to get into low blood sugar because that would be more dangerous, so we just stick to this sliding scale. Now let's see what a sliding scale of 1 unit for every 25 points of blood sugar above 150 look like. If his blood sugar is between 151 to 175, take 1 unit of Novolog. If blood sugar is between 176 to 200, take 2 units of Novolog. If blood sugar is between 201 to 225, take 3 units, so on and so forth. Take 1 more unit for every 25 points of blood sugar. After he started to take insulin according to this scale, his blood sugar went down to the 200 to 300 range in the next day. Still not perfect, but at least not in any immediate danger. After a week, the steroid in his knee gradually worn off, and his blood sugar went back to his baseline of low 100s. Some important points. First of all, wait at least 4 hours after taking a dose of short-acting insulin before checking blood sugar again, because it will take 4 hours to see the full effect of short-acting insulin. If he keeps on checking blood sugar every hour and take additional insulin for high numbers, your blood sugar will crash in a few hours because all these insulin doses will stack up. Second, this video is only intended for people who are not on insulin and who will only take steroids for short term. If you're not familiar with the word short-acting insulin or sliding scale, you can go to hmf-diabetes.com and search these words for more details.